theme, reaching the zero malaria target, and how we can achieve that. How can we achieve that? I mean to say, first, it's by being aware of this parasite called malaria, and secondly, going for, a proper medical checkup and not self-medication. When it comes to this part of the world, we always abuse the excessive intake of paracetamol, and thereby building a serious drug resistance system, which is not very healthy at all. And then lastly, do not do over-the-counter medicine. Go to a doctor and make sure you take your medication judiciously. And please, learn to finish every medication and not stop whenever you feel better. We will take a look at the World Malaria Day theme for 2022, as we will have Dr. Victory join on the show via phone call. Please don't go away.
In 2020, nearly half of the world's population was at risk of malaria. Some population groups are at considerably higher risk of contracting malaria and developing severe diseases. Infants, children under 5 years of age, pregnant women, and patients with HIV/AIDS, as well as people with low immunity moving to areas with intense malaria transmission, such as migrant workers, mobile populations, and travelers. According to the latest World Malaria Report, there were 241 million cases of malaria in 2020, compared to 227 million cases in 2019. The estimated number of malaria deaths stood at 627,000 in 2020, an increase of 69,000 deaths over the previous year. While about two-thirds of these deaths were due to disruptions during the COVID-19 pandemic, the remaining one-third of deaths reflects a recent change in WHO's methodology for calculating malaria mortality, irrespective of COVID-19 disruptions. The new cause of death methodology was applied to 32 countries in sub-Saharan Africa that shouldered about 93% of all malaria deaths globally. Applying the methodology revealed that malaria has taken a considerably higher toll on African children every year since 2000 than previously thought. However, the WHO African region continues to carry a disproportionately high share of the global malaria burden. In 2020, the region was home to 95% of all malaria cases and 96% of deaths. Children under 5 years of age accounted for about 80% of all malaria deaths in the region. 4 African countries accounted for just over 13.2%, United Republic of Tanzania with 4.1%, and Mozambique with 3.8%. Meanwhile, in the fight to end malaria over the last 2 decades, expanded access to WHO-recommended malaria prevention tools and strategies, including effective vector control and the use of preventive anti-malaria drugs, has had a major impact in reducing the global burden of this disease. The vector control is a vital component of malaria control and elimination strategies, as it is highly effective in preventing infection and reducing disease transmission. The 2 core interventions are insecticide-treated nets and indoor residual spraying. Progress in global malaria control is threatened by emerging resistance to insecticides among Anopheles mosquitoes. According to the latest World Malaria Report, 78 countries reported malaria resistance to at least one of the 4 commonly used insecticide classes in the period of 2010 to 2019. In 29 countries, mosquito resistance was reported to all main insecticide classes. Let us join the World Health Organization in creating more awareness as we mark the World Malaria Day today, 25th of April 2022, with the theme Harness Innovation to Reduce the Malaria Disease Burden and Save Lives. Don't forget, you have a part to play if you must have a malaria-free society.
Welcome to the show, Dr. Victory. Please enlighten us more on what these malaria parasites are.
It's okay. Malaria parasite is a parasite that causes malaria disease.
Okay.
It is a protozoa from microbiological perspective.
Okay.
It's a microbiology perspective. It's a parasite, that is called Plasmodium. And Plasmodium is there are four of them that cause routine malaria. We have Plasmodium falciparum, one that causes malaria, devastating malaria, which is common in this part of the world. The tropical environment, Africa, are responsible for severe malaria. We also have Plasmodium Malaria. We have Plasmodium ovale. We have Plasmodium vivax. So these parasites are transmitted by vector, which is called female anopheles mosquito.
Okay.
So when an individual has malaria and this mosquito bites the affected person, it will suck the blood of the person, and then the parasite will undergo some form of multiplication or development within the mosquito as a vector. And then when the parasite the vector, the mosquito bites another person, it will now transmit that parasite, and the parasite will now go into the person's liver, that goes some form of development, some cycle of development, and then enter into the blood, infest the blood, multiply there, destroy the blood cells, and then release toxins into the blood cell, which will now begin to cause symptoms such as fever, sweating, chills, body pains, headache, all those things you have been hearing about, malaria, loss of appetite, vomiting, and so on. So that is how that's basically how malaria is transmitted in the layman's sense.
So what are the possible causes or symptoms of malaria aside from mosquitoes?
Yes, malaria, as I've said, malaria is a disease caused by Plasmodium. That is a parasite.
Yes.
And so the bite by the vector, which is a mosquito, is a commonest means of transmission. Apart from that, there are other ways malaria can be transmitted. There's what we call vertical transmission. That is from a pregnant woman to an unborn baby.
Oh.
So there's what we call neonatal malaria. A child can be born with malaria. Hello?
Yes, I'm here.
So a child can be born with malaria, which is not acquired by a bite by mosquito directly, but from the parasite that is in the mother's transmitted through the placenta.
Wow.
There's exchange of blood and through maternal fetal placenta. Mm-hmm. And then two, malaria can be transmitted through blood transfusion.
Okay.
That's why when blood is to be transfused, we usually do some form of screening. One of the things that we screen apart from HIV is malaria.
Wow.
Because if the blood is transfused from the person that donates the blood who is infected with malaria to the person that is to the recipient, the malaria can be transmitted. Mm-hmm. And then malaria can also be transmitted by the use of sharing of needle and needle syringes and all that. And then through organ transplant, when there's organ transplant, malaria can be transmitted. So these are avenues through which malaria can also be transmitted.
In a country as Nigeria, where we take paracetamol for every headache, Do you advise the use of over-the-counter drugs?
Yes, when somebody has symptoms of malaria, like which the common is fever,
Okay.
there must be fever because it's an infestation and it doesn't produce fever. So alteration in the temperature regulation in the brain, so it produces fever. So fever must be there. So fever, sweating, body pains, headache, loss of appetite, and so on. So when somebody begin to notice those things, although there are some other disease conditions that can also produce those symptoms, So what the person does is to take paracetamol to bring down the fever, the body pains, and why quickly, getting to the nearest facility to get tested. There must be a test and confirmation of malaria parasite. There must be a test to confirm that it is malaria that is being dealt with. We have what is called rapid diagnostic test. Okay. And then we also have microscopic tests.
Okay.
The rapid diagnostic test is a kind of antigen antibody test which is available. It's supposed to be available even in the primary health care centers and all that.
Okay.
So if the test is done and it confirms that it's malaria, then the treatment should be given. And the treatment, the drugs are available. We have artemisinin combination therapy, ACT. Have you heard of it?
Okay.
It's available in the pharmacies, which must be prescribed by a healthcare provider.
Okay, sir.
So the test has to be done, malaria confirmed, and then prescription done, and then the drug acquired.
Okay, sir.
So without the test, you can't begin to buy malaria drugs.
All right, Dr. Victory, before you go, please, can you give your parting shot to the people on malaria generally?
Yes. Malaria is a preventable and treatable condition. So all hands should be on deck to ensure that we have malaria-free society by putting those preventive measures on ground and ensuring that the environment is clean, the vectors are done away with as much as possible. And then two, the drugs should be made available. Everybody should have access to malaria drugs. Supposed to be in a group called essential drugs. These are drugs that are supposed to be readily available, affordable, and then safe, with minimal side effect and all that, So malaria is an essential drug. So it should be made available, So and everyone should have access to it. And those that have attack and get diagnosed and then prescribed should get access to malaria drugs. Malaria should not be death from malaria should be reduced as much as possible. Situation whereby we discovered that as of 2020 we have over 460 dead malaria across the globe. It's not acceptable. With about 221 million attacks across the globe, it's not supposed to be, especially in Africa. So it can be prevented. So the preventive measures should be, should be used to ensure that we do away with it, at individual and community level. Those that have the symptoms should get tested. Situation whereby someone will just walk into the chemist and get drugs. They know of malaria drugs. That is causing resistance. If it is not malaria, and then you are taking the drugs, you are making the parasite to do resistance. Like if the person now has malaria and is taking a drug, the drug man will. So we emphasize on people getting tested and being diagnosed that it is malaria, and then get the appropriate medication.
Thank you, Dr. Victory, for joining us today on Vital Health. It's still your Vital Health program on your favorite TV station, Spectrum Television, channel 136 on Star Times. Please drop all your comments and suggestions on our social media handles, and you can do that on Facebook, on Instagram, and YouTube at SpectrumTV.ng. And now for the 2022 World Malaria Day theme tagged Harness Innovation to Reduce the Malaria Disease Burden and Save Lives. So before we go, let's quickly take some facts about malaria parasite, which are, first, malaria is a life-threatening disease caused by a parasite that is transmitted through the bite of infected female Anopheles mosquitoes. The parasite can cause malaria. The parasite that causes malaria is a microscopic single-celled organism called Plasmodium. And also malaria is predominantly found in the tropical and subtropical areas of Africa, South America, and Asia. If not detected and treated promptly, malaria can be very fatal. However, with the right treatment started early enough, it can be cured. So you don't need to really worry about that. It is estimated that there were 198 million cases of malaria in 2013 and 584,000 deaths. That's a lot. And around 95% of deaths are in children under the age of 5 living in sub-Saharan Africa. However, death rates are falling globally by 47% since 2000. There are more than 100 kinds of Plasmodium that can infect many animal species, such as reptiles, we have birds, and mammals. So that's all we can take today on malaria parasite. And now the health tip for today is not taking your drugs judiciously is building a drug resistance system. So always remember to take your medication judiciously, even when you feel better. Take your medication judiciously. Thanks so much for staying with me on Vital Health, and please don't forget to keep